An exam that can detect a heart attack years before it actually happens. Yes, this exam exists, and yes, it can save many lives. Hello everyone, welcome to another video here on our channel. Join me for this segment of our podcast, SaudiCast, where I talk with cardiologist Juan Paulo Simini about how to prevent a heart attack. You can find the full conversation right here on the channel. Go ahead, leave a like, and share this video with your groups.
And there's something I've seen quite often in my practice. When a patient has all three major coronary arteries blocked, the scintigraphy ends up balancing the image, making it look uniform.
So it gives a false result, right?
Exactly, but the patient is travascular.
I see.
He's on the verge of having a heart attack in all three arteries, and yet the exam comes back as normal because everything balances out. Today we have a gold standard exam. The patient turns 60 and I requested. Coronary CT angiography is a non-invasive exam, and it allows me to see the coronary arteries perfectly.
That's the exam I mentioned, the one specifically ordered to measure plaque.
Exactly. In Belo Horizonte, there's a doctor I refer patients to for this exam. He gives me the exact percentage of plaque,
Showing precisely how things are.
For example, the left anterior descending artery has 20%, the right coronary artery 70 or even 99%. In those cases, they go straight to catheterization.
Yes, then catheterization is indicated.
Got it? So, medicine, folks. Technology came to help us evolve, but some of our colleagues are still stuck back there. Clinical evaluation is essential, except in cardiology. Not everyone experiences chest pain. I have several patients in my office who felt absolutely nothing. I ordered a coronary computed tomography angiography, and all 5 stents were placed at once. He was on the verge of sudden death, and he felt nothing. And there's another very important point. We focus so much on chest pain. Many conditions and many heart problems don't cause chest pain. They cause fatigue. Sometimes the patient says, look, I used to climb stairs without getting tired, and now I climb them and feel exhausted. That's when you should also investigate the coronary arteries. The patient goes to a pulmonologist, nothing is found, then you order a coronary CT angiography, and you see the arteries are already obstructed. Because oxygen delivery is impaired, the heart doesn't perform well and starts to tire more easily. Cardiovascular disease is extremely complex. Juan Paulo and I established a rule in my practice. Anyone turning 60 gets a coronary computed tomography angiography, regardless of symptoms, so we know their condition. I'm already considering lowering that age. I'm thinking of bringing it down to 55.
Yes.
I'm really thinking about bringing it down to 55. He just turned 55.
So it's almost time for me to do it too then.
If a coronary computed tomography angiography shows clean arteries, you're good for 10 years.
Yeah.
Understood? Then in 10 years, you ask for this exam again. Another good way to evaluate risk is through the carotids, doing a carotid Doppler and an abdominal ultrasound. If the vessels are clean and there are no plaques, the likelihood of having disease there is lower. And if there is plaque there, the chance of having it in the coronaries also increases. So I usually start cardiovascular screening there, where abdominal ultrasound and carotid ultrasound. If the aorta and the carotids are clean, the chances that the coronary arteries are also clean are higher. But that's not a strict rule. Okay? In cardiology, we need to understand this very well.
It's an investigative process.
Exactly.
That's what I always say. When you go to a healthcare professional, there are 2 things that I keep in mind and that I always tell my followers. Look, doctor, you're already around 70 or 75 years old. You're having symptoms and some memory loss, right? You're feeling tired, experiencing fatigue, right? Slower thinking. But whatever the symptom is, if the doctor tells you that's just your age or it's because of your age, change your doctor. Change your doctor. Another thing that worries me, and that happened to my mother, is hearing, no ma'am, you're fine. They run a basic test, a routine blood count that doesn't show much, and say, no ma'am, you're fine. With a vitamin B12 level like that, right? They say, ma'am, you're fine, when clearly she isn't. Memory problems, slow reasoning, even her movements. Slower, classic signs of, well, maybe it's not even that, right? She was also taking a statin she didn't even need, with her coenzyme levels way down because she wasn't supplementing either. So in my opinion, the 2 most dangerous phrases are, that's just your age, and no, you're fine.
Someone who works with me had her son diagnosed with attention deficit hyperactivity disorder and autism. And that's okay. He might truly have it, right? But where are the basic tests? They medicated him right away.
At least take some amphetamine, right? That's strong.
A controlled prescription, but they skipped the basics. I said, it could be that, but let's check vitamin B levels, thyroid stimulating hormone T4 and T3. He's 16. Let's check the basics first. If the basics are off, then everything is a mess. Let's fix the basics. Did it improve? Great. If not, we move on to the next step. How can you diagnose something without checking the basics first? Vitamin B12, iron stores, how the thyroid works, and they already prescribe a controlled medication.
My friends, don't forget to visit my website. There you'll find all the supplements I use and recommend, as well as my other social media and my courses. It's www.moacir.com. And don't forget to subscribe to the channel of our new podcast, where I bring in the top health experts in Brazil, so you can get even more information to take care of your health, age more slowly, and have much more energy. I'll be waiting for you on our podcast. Big hugs, my friends. I hope you enjoyed it. I hope this video was helpful, and I'll see you in our next conversation. See you then.